Committee meeting to order April 3rd, 9:49 a.m. All members present, less Mr. McTaggart. Do I have a motion to approve the agenda for today?
So moved.
It's been moved. Is there a second?
Second.
Any discussion on the agenda? Take a voice vote. All in favor to approve the agenda, say aye.
Aye.
Opposed, same sign. Motion approved. Public comments? Agency reports? None. Iroquois County Public Health Department.
Good morning.
Good morning.
Happy National Public Health Week. I'm sending around a copy of Governor Rauner's declaration stating that this week is Public Health Week. I'm not going to read it to you, but one of the things in it says, whereas inside health departments in every corner of the state, public health workers ensure the basic foundations necessary for good health: clean water, safe food, breathable air, and access to life-saving vaccines, just to name a few. So we did do a very, very short, because there's the Illinois Public Health Association is doing so many press releases this week. We decided not to bombard the local press. We just did a very, very short thing, press release that we sent out yesterday, just talking about some of our services. And we didn't go through all of them by any means, but we, wanted to at least put something out there for the public. We are still doing flood recovery efforts throughout the health department. Most of the restaurants that were flooded that have an intention of reopening in the same location have done so. We still have two that have not been reopened, who either intend on raising or moving. So we'll, follow up with them when those decisions are made.
Who's that?
I won't get the name right, Gas Depot, there by Scotchman's West. I spoke to Raj myself, but his intention is to raise it. But according to his estimations, it will take at least 6 months before he gets everything worked out through that system. So, there's a lot more involved in what people think. Like moving liquor is a big deal. Making sure that the liquor bottles were not contaminated with floodwater, storing those. A lot of documentation, a lot of back and forth paperwork with us and with Springfield. There's a lot that goes on, behind the scenes that people don't realize. A lot of work for these people. The water samples that we're doing, I'll tell you what, we'll go over water samples in a minute when we go over water samples. But our staff is kind of winding down with that. We do still get a lot of calls from residents about mold mitigation. What do we do about the mold? So we go over with them, what are CDC recommendations for, treating their home for mold, and we, have all that information on our website, and we tell them we'll be happy to print anything off to them and mail it to them, or they can stop in and get it, that kind of stuff.
What do you use for mold?
It depends on what surface you're talking about, because different surfaces, mold's going to go
Bleach
differently.
doesn't cut it, does it?
What?
Does bleach cut it?
Not always, no.
That's what I thought.
No. Right now, the best thing that,
It does.
a huge blessing for Iroquois County residents is that the Southern Baptist people are still located down in Woodland at the Cornerstone Church. I have that number if anybody needs it.
Please give it to me.
I can do that. I have it on my phone, in my office. But they're doing a procedure for residents called
They're fogging.
shockwave.
Right?
It's
Chlorine dioxide?
It is a really fine mist more than a fog. It's a mist, and it covers every surface. You have to leave the home for about 4 to 5 hours, and nothing alive can remain in the home while that mist is being sprayed. The machine looks like a bullet, but they're doing that for people, and they're doing it for people free of charge. This is all done by...
The chemical doesn't cost anything, though.
The chemical's very, very inexpensive. I looked it all up to see how much a machine would cost, because I thought about doing that in our basement. Our basement's block walls and cement floor, but we've got the wood rafters. They didn't get wet, but it's so moist down there that, you worry about that. The machine that they use is called Fibrio, and they told me where to, that they can get them on Amazon, and they told me that the chemical that they use is Shockwave, and so you can buy a system for not a lot of money. But right now for a lot of people that's, even if something's under, $1,000, it's still expensive for people.
I just cleaned some bleach up, or some mold in my house, and I used bleach and water mixture. Cleaned it right up.
Yeah.
It might have cleaned it, but it might not have killed the spores.
Yeah.
That's the difference.
Yeah. So, right now we're still referring people down, who need help in Iroquois County to Southern Baptist, and they have been so wonderful. I've talked to the guy myself 4 or 5 times. They're just the kindest people.
That's where?
They're set up an office at the Cornerstone Church in Woodland. At the Cornerstone Church in Woodland, which is the old school building in Woodland.
Yep.
And that's where they're working out of, and they're wonderful. And I spoke to him last week, and he said they anticipated on still being in the area for at least a couple weeks.
Can you take that number, please?
Sure. So the flood mitigation stuff is ongoing. The senior services staff are the ones right now that are overwhelmed with flood work, trying to help the clientele. They're helping with assessments. They're doing a lot of community needs assessments as far as, and individual needs assessments as far as casework for people. Unbelievable amount of work. But those girls are plugging along and doing the best they can. Any questions about flood stuff? I did not bring you a new grants and contracts list because last month, remember, was the first month that everything was signed. So nothing has changed. I will tell you this much. All the grants that I write for the health department, I write most of them, almost all of them, maybe 3 or 4 we don't. But all of them are written through a program called eGrants, that is a state grant management system. All health departments write most of their IDPH grants or their DHS grants through eGrants. I was told unofficially last Friday at a regional administrators meeting that the vendor who owns that system has the contract that they have with the state of Illinois is up, and they want to charge a lot more than what the state of Illinois anticipated. I was told that the state of Illinois is not going to go with eGrants. And so as of June 30th, there's a possibility that we don't have a grant system. So I spoke with Elmira Giancello. She's our regional health officer for our region, and she said that she doesn't know of anything that's going to replace it. At this point in time, we do have one grant sitting in eGrants that I have until the end of May to get done, and that's our dental sealant grant. But as they come in, we're probably not going to be writing them in eGrants because it might go away, and even though you can print out what you've done, they won't be state approved. It won't have gone through all that 4-step process that I've explained to you guys before. So there won't be any sense in doing it. So right now we're kind of on hold with that. So we'll see what happens. But if nothing else, we'll go back to master copy paper grants, and we'll do what we got to do to get them. So here is your program summary report. One, two, Marvin, two. And we'll kind of go over a few things on that, because I'm sure there'll be a few questions on this. Usually I take a highlighter and go over the ones I'm pretty sure that you guys are going to ask about, and didn't do that this time, but I just got some notes here. So the first page, they're numbered at the bottom. The first page is environmental health. So you can see that Terry was busy this month. Terry and his staff were busy with re-inspections, inspections and re-inspections. He did 23 re-inspections. He issued temporary permits. You know, typically March isn't a re-inspection month. So that's a bigger number for March, but obviously a lot of that to do with the flood, right? We had 2 food complaints that were investigated and mitigated. We gave out 47 water sample kits. Now we're still giving out free water sample kits so that people can have their well water tested. If you look at the number, out of the 47 kits, 17 of them were unsatisfactory. That rain. Oh, wow. Yeah. The 17 of them were unsatisfactory. That's not good. That is not good. Most of it's too late.
Was that because the caps were exceeded?
Yeah, that's just groundwater got into the well,
Right.
A lot of it. And that surface water we know held E. coli, so some of them are coming back positive for E. coli, some of them are coliform bacteria, there's E. coli. So that's a big concern. So we're going to, until we start seeing less numbers that are coming back unsatisfactory, the health department is going to continue to give out these water samples free, and we'll cover the cost of the shipping, and because I think that encourages more people to get their well water tested, and we don't want people. Did I explain to you last time when you drink water that has E. coli in it, what happens to you? No. Well, you get sick. Obviously, you may have diarrhea for quite a while, but what happens is you get something called steg, and steg is a staphylococcus. It's a steg is an infection that is caused from the toxins that E. coli give off, and those toxins can do a lot of body damage, especially kidney damage. So people who drink well water with E. coli in it have a much, much higher rate of acquiring steg and then ending up with permanent, long-term kidney damage. And some of those people end up having to be on dialysis. And a lot of people that are on dialysis, this is what happened to them. And so this is completely preventable if we're testing water and we know what we're drinking. So we take that extremely seriously, and we're still continuing to offer these free test kits because we want people to test that water. It's so important for your health. Yeah.
That's fine.
Yeah, we sure do. We do. We've had, we also have the exact opposite. We have the buyer wanting to see the proof, So, yeah, and that's all actually in our So, that's not something that's super protected. Because the safe water is for everybody. And I explained a little bit last time about the aquifer, and so even if you're somebody who's well tested okay, if you have a neighbor who's did not test okay, that can, affect the aquifer. So it's depending on what that water's flowing. So we tell people, your neighbors that have had problems, keep testing. You might want to double check your well water. Keep testing it to make sure that what you're drinking is safe. So you can see we did a lot, 47 of those kids, and then 17 of them were unsatisfactory. What some of the mitigation that they're doing is some of these wells that are coming up positive for E. coli, obviously they'll chlorinate them and all that kind of stuff, and if that after chlorinating them, if it still doesn't come back, sample still comes back abnormal, then we've had well drillers that are going in and they're blowing out the well, So yeah. We had one well where we even had to remove all the casing, to take a water sample without any, metal contamination, to see if that was, because they wanted to know how affected they were, yeah. So they've been busy with that kind of stuff. So even though it doesn't look like a lot of well inspections, field well inspections and stuff like that were done, some of those cases are pretty extensive and take a lot of hours. We did 21 radon kits this month. 2 of them have come back. Some of those we don't have all the results back yet, but 2 of them have come back with a radon level of greater than 4. So we'll be working with those homeowners on mitigation issues.
Do you find radon in a lot, only in real small?
Yeah, I mean, Iroquois County does happen to sit on some land with some uranium, because, radon gas is from the breakdown of uranium in the ground, and Iroquois County does have uranium in the ground. So that's why we encourage everybody to test their home for radon. And yeah, we see lots of homes with small amounts, but they aren't considered, at a dangerous level.
Well, you gave me a kit, and we tested it and sent it in. And it came back, we had a very small amount of radon. Nothing to be concerned about.
Yeah, that happens with a lot of people. I tell people that if you have a small amount of radon that the test has detected that, test it again in 6 months and see where you're at. Test it again next year and see where you're at. Because that breakdown of uranium, there are lots of things that affect the breakdown of uranium in the soil. So that could change over time. So it's a good idea.
It can change.
It can change, yeah. So keep an eye on it.
Can it change and be negative as well as positive?
It can, yeah. It can.
Okay, thanks.
But it's a good idea to keep an eye on it. Because, like I've explained before, radon is the second leading cause of lung cancer behind smoking. So if you, are somebody who's never smoked and you or your family member has gotten lung cancer, a lot of times then the doctors will say to you, you better get your home tested for radon, and you'd be surprised how many people's radon levels are. And you just didn't know it. So that's something to definitely check. Under community, you guys have any questions about the environmental health portion of that? Under community health, childhood immunizations were down to 48 last month. March is typically not a high month for us anyway, but I did compare that number to last year's, but it was a lot higher last year. So we're not the only ball game in town giving shots right now again. So which is fine. Our job is just to make sure that kids are getting vaccinated. And if they get them at the health department, great. If they get them at their doctor's office, that's great too.
So what's the reason it switched back?
Because there for about 8 months, we were, other than ABC Pediatrics and Clifton, we were the only ones in Iroquois County doing it.
Oh, they just weren't doing it.
Yeah, they just weren't doing it. And because the VFC regulations got to be so much, most doctors' offices dropped it. Now think about this, and I'm going to be honest about it, and I know we're camera, but with the VSC program, the Vaccines for Children program, the vaccine is provided, at state or federal cost. You are allowed to charge up to the Medicaid reimbursement rate for your administration fee. Okay, right now that fee I think is around $23. Now, most I wouldn't say most, but I'd say a good, probably more than half the county health departments in the state of Illinois charge $23 for their admin fee. That's their nurse's time, their alcohol wipes, their syringes, their Band-Aids, all the stuff that they need, the paperwork. We charge $15. We're one of the lowest in this. In fact, I think we are the lowest that I'm aware of. But that's okay, because we're doing fine with that, and our numbers are good, and I want to keep the costs as low for the citizens as I can. But if you're taking a 15-minute time slot to do immunizations, which used to be 2 pieces of paper, years ago when I gave immunizations, I'd give 200 a day myself, when back in the old days, the kids would be lined up around the block. Now we do everything by appointment. We take walk-ins, we absolutely do, but we take the appointments first. So we do everything by appointment, and in a 15-minute time slot, you may give one family immunizations or one child immunizations. Well, because it takes them a while to fill out paperwork, and there's all kinds of paperwork, and the paperwork has really grown because now there's HIPAA consents and there's cornerstone consents to put them in the state system and all this stuff. A doctor's office doesn't necessarily want a 15-minute time slot filled for something that they can only bill $15 for, when they can use that time slot for a billable service where they're seeing sick people. Okay? So a lot of doctors just plain aren't doing immunizations anymore because it actually costs them money instead of them making money. So, you can't blame them. So we're doing it at the health department to make sure that we keep as many children. We want to keep vaccine-preventable diseases down in Iroquois County. If we don't do the immunizations, we'll be investigating the diseases. So it's going to cost us either way. But our business is to keep children disease-free.
Are there still people waiving vaccines too, or no?
Not very many.
Not very many.
We don't, there was a big trend of that for a while. We just don't see that anymore. People don't. I think a lot of the research has come out that they aren't as dangerous as people were claiming that they were at one point, So, and they're finding out that, the whole vaccines causing autism, that's not what causes autism. It is not. And if you do really research that, that's not the cause. If you look down the reportable communicable disease investigations that we've done, it wasn't a huge heavy month, but we have some odd ones. So if you look at our total FY18 number of chlamydia cases so far, and I'm looking at that number, and I'm looking at FY17, we're about where we were probably last year, but we have a potential for having much higher numbers than we did in 17. Now, I want to explain something to you guys so you understand this, because a lot of people freak out when they hear that the state has placed us under an outbreak. If you're placed under an outbreak assignment, you're given an outbreak number by the state, and that they will, and even if we're not claiming that we're having an outbreak, they will assign us an outbreak status anytime that our numbers go 50% above the previous years. Well, look at our hepatitis C numbers. We already have as many cases just so far this year as we did the entire year last year. I'm going to tell you, we're going to be in outbreak status, assigned outbreak status by the state. It's going to happen.
Is that because of drugs?
No. Yes, absolutely. Hepatitis C can be caused from, it can be sexually transmitted. It can be, it's usually blood. Hepatitis C is bloodborne. It can be used, from IV drug users. It can be from, you got a tattoo with a dirty needle, whatever. It's usually bloodborne. The reason I think I said this to you guys last time, and I know I explained this at the Board of Health meeting today, one of the reasons we're seeing higher numbers is I don't think that we're actually having more cases, because when we do an investigation, we also have to classify hepatitis C as an acute or a chronic. And most of ours are not acute cases. Most of them are chronic cases. So that means that someone was probably infected years ago. Well, you've seen the big billboards, right? You know, if you were born between this year and this year, get tested. I think what we're seeing is not necessarily more cases, but more people being tested and it being identified. Does that make sense? Okay. We have had another histoplasmosis investigation. And remember, that's usually from bird droppings, cleaning out the barn, you know, that kind of stuff. So people that cleaned out their barns last fall after the harvest, you know, and were getting ready to put their equipment away for winter, and then, you know, got you know, exposed to histoplasmosis, then tend to get sick over the winter, and so that's what we're seeing. And then you'll see that there's a leptospirosis case. We did not have any of those in FY16 or 17, so that's a little new one. So I wanted to tell you just a little bit about what that is. Leptospirosis is a disease caused by a bacteria, Leptospira. Human disease is associated with contact with wild and domestic animal urine. It's extremely rare, with only about one human case recorded annually in Illinois. Guess who got it? It is spread mainly by contact with water or soil contaminated by the urine of infected animals. Persons can get the disease by swimming or wading in fresh, unchlorinated water contaminated with animal urine, or by coming into contact with wet soil or plants contaminated with animal urine. Chlorinated water, such as swimming pools, has not been shown to transmit it. It's usually found in unchlorinated, you know.
So you think it was from the flood?
It could be. That one will not appear in next month, but it's still going to be under investigation for quite some time. It's diagnosed with a specific antibody test available through the state lab by culture. They culture it. So we're still waiting on that. So, you know, the symptoms of that include a high fever, headache, chills, muscle aches, conjunctivitis, which is, you know, your red eyes, diarrhea, vomiting, kidney or liver problems, anemia, a rash. These can last anywhere from a few days to several weeks. And although deaths have occurred, they're very rare. And people can be infected and have no symptoms, so they don't go get treated. So it's probably more common than what the numbers show, but yeah. The incubation period is usually 10 days, but can range from 2 to 21 days. They also, you know, treat that with antibiotics, penicillin, streptomycin, tetracycline, erythromycin, that whole group. It can be prevented by not swimming or wading in freshwater streams or ponds or lakes if you have open cuts or sores. There's a whole bunch of other information. Yep. Oh yeah. People don't realize how bad that is. When we tell all these kids, stay out of the water, the flood water.
I used to drink out of the streams coming out of the field, for heaven's sakes.
I did too. Me too. The other one, that's a new one, is called vibriosis, and that has been classified by the state as a probable case for us. Vibriosis is an intestinal disease that's caused by the bacteria Vibrio. It's found in fish, shellfish, in salt water, and rivers and streams where freshwater meets saltwater. And it's usually spread by eating raw or undercooked fish, or by, you know, failure to keep it cold or poor food handling practices. The symptoms include cramping, diarrhea, vomiting, headache, fever, chills, and Symptoms usually appear 12 to 24 hours after you consume the fish and take up to 4 days. And there's really no treatment for it. You have to literally ride it out. So what we do is treat people for, keep plenty of fluids. They don't want them to get dehydrated, and they have to, severe cases, they'd be hospitalized and be on IV fluids and so forth.
So how do you find out about someone having a case like that? They go to the doctor and then the doctor reports it to you?
Yeah, when someone goes to the physician and they have signs and symptoms and the doctor puts them on something, that treats more common things and that doesn't work, then you start running other tests. And sometimes, it gets to the point where you exhaust the common tests and you just make uncommon tests and then this shows up. Yeah. So, but the state has classified this as a probable case. So, yeah, cook your fish well.
Yeah.
Do you guys have any more questions about the community health portion of this? In a few minutes, Jane's going to talk to you about the breast and cervical cancer program. But otherwise, the numbers are pretty much on track. We did 101 vision screenings, 116 hearing screenings, and then senior services, the adult protective service programs, they have, look at the open cases that they have. We never reached double digits. Never. That I've ever known of. So, a lot's going on. It is stressful for people when they go through a disaster like the recent flood, and people lose a lot. That's when you tend to see, Johnny forging checks out of Grandma's checkbook, and Grandpa's upset and hits Grandma. That kind of stuff typically does happen when there are disasters. It's unfortunate, but stress does horrible things to people. It really does. So we see increased cases as well. So those girls are really, and besides this, what this report doesn't say is all the flood cases that they're taking on, the assessment cases, to do casework for the Long-Term Recovery Committee. So I don't have numbers for that right now. I didn't even think to get those. The Long-Term Recovery Committee is a group, a big group of businessmen and women, local leaders and volunteers, and just community members who want to help and who are meeting and taking responsibility for making sure that people get some help that they need. I do have one more thing before I turn it over to Jane, just so that you know, I did put on the Iroquois County Public Health Department website, Facebook page, our new Facebook page, where I've been sending out stuff. I did put some IDPH information on there in the last few days about synthetic cannabinoids, because, you know, as of yesterday, the new Illinois Department of Public Health sent out a siren alert. And the siren alert says, as of April 2nd, which was yesterday, IDPH has received reports of 56 cases, including 2 deaths, linked to an outbreak since March 7th, 2018. These cases report using synthetic cannabinoid products before suffering from severe bleeding. And so far, there have been 17 cases in Chicago, 5 in Cook County, 1 in DuPage County, 1 in Kane County, 2 in Kankakee County, 1 in McLean County, 14 in Peoria County, 12 in Tazewell County, 1 in Will County, and 2 are under investigation where they haven't determined the county of residence right at the moment. So that gives you 56 cases. Many of the cases reporting acquired the synthetic cannabinoid products in the Chicagoland area, but contaminated products could be in counties across the state. Individuals reported obtaining synthetic cannabinoid products. Typically they're called things like 2K or Spice. people around here call it legal weed. They buy them in convenience stores and from dealers and from friends. So we're telling people, if you have purchased any of this product in the past month, do not use it. If you've used any of these products and start experiencing severe unexplained bleeding or bruising, please have someone take you to the hospital immediately or call 911. Do not walk or drive yourself. Tell your healthcare providers about the possible link between your symptoms and the synthetic cannabinoid use. They're human-made, mind-altering chemicals that are either sprayed or dried, shredded plant material, and they can be smoked or sold as liquids to be vaporized and inhaled through like e-cigarettes and other vape devices. They are sold for recreational drug use with the claims that they will provide the user of the effects of cannabis. These products are known as herbal or liquid incense and have other names like Black Mamba, Bombay Blue, Gene, but they're also packaged under other brand names too. They're called cannabinoids because they are similar to chemicals found in the marijuana plant, and because of this similarity, synthetic cannabinoids are sometimes misleadingly called fake weed. They are often marketed as safe, legal alternatives to the drug, but in fact are not safe and may affect the brain much more powerfully than marijuana. They are dangerous or even life-threatening. Synthetic cannabinoids are part of a group of drugs called New Psychoactive Substances, NPS. NPS are unregulated, mind-altering substances, and they're newly available on the market and are intended to produce, the same effects as illegal drugs. There's a lot of information out there. They also have found, WGN reported last night that they found, 3 people were arrested for this last night. There was a big thing on TV about it. But they are lacing these synthetic cannabinoids with rat poison and with anticoagulants, blood thinners. So these people are literally bleeding out their eyes, their nose, their mouth, their ears, and they're
warfarin will do that right now.
Yeah.
Too much warfarin.
Yep. So they're laced. So we are hoping, that as they're going, the IDPH website, for your information, is going to update this count of cases every day on the IDPH website at 1:30 p.m. So let's just keep hoping as we look, we don't see any Iroquois County cases. But I thought I'd say something to you about it because I am trying to get that information out to the public. So, Jane's going to talk for a few minutes about the Rest and Serve Local program to you.
Hi, I'm Jane Newell. I'm one of the nurses at the health department. You can pass one of those around. I work with the clinic services, but a portion of my job is working at the Illinois Breast and Cervical Cancer Program. It's a program that provides free screenings, breast and cervical screenings, cancer screenings to women between ages 35 and 64 that are uninsured in Illinois. Every state has a similar program across the country, but so you have to live in Iroquois County to get the services through us and be uninsured and then fall within the 35 to 64 age range. And those are the only requirements. There is a new, in the last few years, since Obamacare came out, and a lot of people have obtained insurance, but a lot of those insurance programs, plans have a very high deductible, and so they might cover their screenings, but if the woman has an abnormal screening and needs further diagnostic services, she would have to pay out of pocket until her deductibles would be paid in full, until insurance would cover anything. So those women, if they have an abnormal screening through their insurance and they can't pay their deductible to get the diagnostic services, they can enroll in our program also. and then we would help pay for those diagnostic services up to whenever their insurance would kick in. I thought I would just give you, like, run through how a woman might find out about our services and then what I do to help her. So we might get referrals from doctor's offices. We might just have a woman call who saw our flyer somewhere and heard about our program, and so I just make sure she falls within the guidelines of the age and residency and no insurance, and then I help her get connected with the doctor's office in the area that we have a contract with. So we can only provide payment to doctor's offices that we have contracts with, but we pretty much have contracts with all the providers in the county, and then some, like Riverside Hospital, Carl Hospital, if they're going for further treatment. So if she already has a doctor line, that she's established with, we can just continue the care through that doctor. She has to fill out paperwork, of course, and once she fills that out and I approve her, make sure that she falls within the requirements, then she's free to make her own appointments if she wants. I can help her schedule her appointments, and she just goes on with services like normal at a doctor's office or hospital. So we don't actually do the screenings at the health department, but we provide the case management services, and then the bills then come to the health department instead of to the patient, and then we process those bills, pay for the services. They have to follow, the doctors have to follow certain guidelines that IBCCP, the Illinois Breast and Cervical Cancer Program, has established. So, they have to, they can't just order all sorts of tests that don't, it's kind of like an insurance company in that way. They have to do things the way the state wants them to, but usually that's not a problem. So then the bills come to us, and then we pay for the bills, and then we get reimbursed from the state for those services.
Does this include treatment or anything if it turns out to be?
So if it turns out to be cancer, it would cover any of the diagnostic services leading up to a diagnosis, and if they are diagnosed with cancer, then Illinois has a system in place where they can get coverage then through Medicaid. So then I help them with that process, and it's really pretty quick as far compared to just enrolling in Medicaid normally.
If you have cancer,
Right.
you need help.
Right, and so then Medicaid kicks in and pays for the treatment. So that's kind of a...
Yeah. The current statistics, and I don't know if these are the same ones you have, but the ones I've been reading, the current statistics for breast cancer is that 1 in every 8 women will get breast cancer at some point in their life. That's a lot of breast cancer. By far, that is our #1 cancer in Iroquois County. We see more of those cancer reports coming out of IDPH than we do anything else. Probably second is colorectal cancer, which is why we're doing the FIT screenings now, but breast cancer is, very serious, and if we can help people get diagnosed at an earlier age, we don't want someone, I keep trying to explain to people, and I don't know if I do a good enough job. Public health is not public aid. We're not public aid, okay? And our services are for everybody, okay? The difference between public aid and public health is we do things, clean water, clean food. We're trying to help everybody. But this breast and cervical cancer program grant that we have, the lead agency is actually Livingston County. We don't own this grant. This is the grant we are a sub-awardee from Livingston County. Most breast and cervical cancer programs go to a bigger agency, and then they fund other counties. So Livingston funds Ford County, they fund us. But we wanted to make sure that people in Iroquois County who especially if they're diagnosed with cancer, had a means to get treatment, because no one should die from something and leave children and people. And every one of us can probably think of somebody that we know who's been diagnosed with breast cancer. And it's devastating to not only the client and their family and, their friends, but to the community. And so, so this is one of our programs that we do help people, link people up to Medicaid if they need it. But, I keep telling people that, most of our programs are not income-based, they're not, just for people that don't have insurance. Almost all of our programs at our health department are for everybody. This one is for everybody too, but this one we do link people up.
There's a very small percentage of men that can be diagnosed also.
Yes, that's absolutely correct.
Yeah, and there is a part of the program that can be used for men if they're diagnosed. Also, if there is a woman that needs services who is below that 35-year-old age, if they have certain documentation from their doctor of some abnormalities that have already been found on their screenings, I can get approval from the state for them to qualify for the program too if they don't have insurance and they're younger than 35 and say they have a breast lump, then they can get enrolled in the program as well. So there are some
flexibility.
Yeah, based on what their symptoms are and what the doctor has found. Any questions? Thank you.
Very well explained. Good report. Any questions
Thank you.
for us?
That's good.
Good report.
Is there any old business to come before the committee? Any new business? I would entertain a motion to adjourn.
Motion. I beat you to it, man.
Moved by Kevin, seconded by Dan. All in favor to adjourn, say aye. Aye. Both same sign. Meeting adjourned.